Welcome back to Good Morning Arkansas. Millions of Americans suffer from knee pain caused by osteoarthritis, and many are looking for alternatives to pain medication or ways to better manage pain before and after joint replacement surgery. Arkansas Surgical Hospital's Dr. James Caldwell is here to tell us about an innovative treatment called Iovera. It's a non-opioid option that uses cold therapy to target the nerves responsible for pain. Dr. Caldwell, welcome.
Thanks for
to
having
the
me.
show. I think anyone having joint replacement surgery wants to hear about this.
Oh, for sure. So we just started doing this at ASH about a couple years ago. There's a Dr. Hart that really took off with it. Now I've kind of picked up the reins on that. We do more knees than anyone in the state, and we're really always looking at ASH. How do we optimize our outcomes? How do we optimize the patient experience? And this has been a big part of that.
So it's called Iovera. Tell us how it works, and you actually have it here.
Yeah, so I have it. So the theory behind it is, I don't want to bore you with medical details. Nerves are like wires.
Okay.
They have a little sheath, and then the wire components are in there. What you do by freezing these little nerves, it only provides sensation to the knee, is that you just kind of destroy a little bit of the nerve in there, but not enough to like harm it or anything, just enough to make it stop working. And in the next 3 to 6 months, when that thing is trying to grow back and heal itself, you should have significant pain relief in your knee.
So this is done before the patient leaves the hospital?
It is done before you even get surgery. So we'll do that anywhere from 10 to 14 days before your surgery. Typically, they'll send them to me. I'll meet them day of. I'll evaluate their knee, and then we'll do the procedure. It takes all of about 20 minutes to do. It's through this little device. Every freeze on this, there's these little needle at the end. It takes about 2 minutes of freeze, and there's 5 freezes total. So that's kind of why it takes so long, but it's not very invasive at all.
Okay, good. And I told Dr. Caldwell I have a personal connection to this because my husband had a knee replacement at Arkansas Surgical Hospital. I don't think this was around then, and he was in a lot of pain. When he went, I can tell you, he was in a lot of pain, and people just, you know, you don't want to get on those opioids for sure, so we're always looking for an alternative.
Always, yes, and this is a great alternative because opiates, if they worked well, we wouldn't be looking for things like this. Opiates, they have their myriad of issues. Addiction aside, just your typical, they don't work that well. So we're trying to find a way more biologic to how do we block this nerve and give you pretty much no pain after surgery. And we've been getting about every 9 out of 10 patients, they tell me, well, maybe I took 1 pill after. And that's really about it. We've had really good results with it. Minimal side effects as well with this procedure. Typically, you're just looking for, maybe there's a little pain around the site where we did it, a little soreness. You always worry about a bleeding infection when you stick somebody with a needle, but that's a very, very low percentage of people you actually worry about. So very safe, very effective.
Arkansas Surgical Hospital, such a great place for all of those surgeries. Is anybody for knee replacement a good candidate for Iovera?
I mean, honest, anyone's a great candidate for Iovera, especially for knee surgery. Right now, Medicare pays for it mostly. There are some other carriers that pay for it. Hopefully, eventually, we get kind of broad spectrum coverage because we're seeing while doing this, people are doing better in physical therapy, they're more active after, and less scar tissue forms, they have less pain after surgery, and they really push it and break that implant in, and they do so well.
Yeah, do they start to feel the relief right away?
They'll feel better walking out, typically. It won't be full effect. That'll take sometimes a few days to a week. But then I always have to tell patients, like, you're going to feel a lot better. You still got to get to surgery. You still got to fix your knee. But they always ask me, like, do I have to get surgery now? Like, yes.
Yes. When you know, you know. That's exactly what I learned. Okay, so if we go to one of our surgeons, should we ask about this since it's something kind of new?
Yeah, it doesn't matter. Your surgeon doesn't have to be affiliated with ASH. Just ask about it because at the end of the day, if they need it, they'll send them to me or anyone that does it well. Just ask your surgeon about it, especially if they're doing knees and you've had a lot of pain. I have some patients that have had knee surgery here they're getting it here, and now and then they get it there with Iovera, and they're like,
Yeah.
wow, I'm never doing that without
They're
it
like,
again.
I want the Iovera now. Will it be used on any other surgeries, hip replacements or something else?
It could work for hip replacements. It could work really well for shoulders too.
Okay.
So we're still, a lot of the studies are preliminarily coming out for those. The data right now has been really focused on knees. And they've done so well, now they're looking at about ankles, elbows, wrists,
Yes.
shoulders, even nerves up here.
Okay.
They're working on it. And we're getting good results. None of those are completely out yet, those studies.
The latest technology always at Arkansas Surgical
Always.
Hospital. Thank you, Dr. Caldwell, for
thank you
coming
very
in.
much.
And this will be great news if my husband ends up doing another one as well. We'll be back. Thank you so much.
Thank you.
Okay, more of Good Morning Arkansas right after this.